What's the best solution for eye hollowness? I'm 19 and I have eye hollowness, which makes me look tired all the time, even if I'm not. I have had it since I was a baby, so what's the best for it?
Thank you for your question. You're 19 years old and you've submitted a photo and you're asking what's the best solution for under eye hollowness. Well, certainly I can address this question for you, but I would caution you at 19 to most likely delay any intervention, but I think it's important that at least you understand how this issue is addressed in a practice such as mine. To give you a little bit of background, I'm a cosmetic oculofacial plastic surgeon specializing in cosmetic and reconstructive procedures of the eyes. And I've been in practice for over 20 years in Manhattan and Long Island. So the issues with hollowing is, as you described in your situation, obviously not age-related, you're very young, but it does happen commonly with aging. So to give you a sense of what we do, and again, I'm cautioning you at a young age to not necessarily pursue this because there is maintenance involved and it may be difficult, and particularly important for you to also understand is that your face may be still maturing, which means that a lot of things are still changing, and it may not be as important later in a couple of years as it, or as significant, I should say, as it is now. But to address under eye hollowing, we're talking about typically the tear trough area and the V deformity area under the eyes. Now these particular anatomic areas, when these are particularly deep, can certainly make the eyes look very sunken and make the individual look very, very tired. In our practice, we routinely treat this area with fillers such as a Restylane or Juvederm. These fall in the family of hyaluronic acid fillers. Now this is a very delicate area and it does require a thorough knowledge of the anatomy and a precision to actually make these corrections successfully and consistently. Now in addition to that, we also use something called platelet-rich plasma. In patients who have more of an age-related change, platelet-rich plasma works very well with hyaluronic acid. In other words, what it does is it stimulates collagen, stimulates blood supply, and we've seen the aesthetics of the eyes improve greater than when we do hyaluronic acid alone. And it's routine for us, since we have so much experience with platelet-rich plasma, or PRP, to actually do this in combination and get very, very nice results. We routinely also follow our patients very closely. We want to see how they respond to the hyaluronic acid. Sometimes people swell, sometimes people need reduction, maybe sometimes they need a little bit more. So there's a lot of finesse and obsessing to try to get the areas to look right, because it's pretty unforgiving. You know, people commonly come to us from experiences with other doctors who do the injection and then essentially don't follow them that closely, and they're lumpy and they're irregular, and very often we have to use hyaluronidase to get rid of the hyaluronic acid. It's an enzyme used to dissolve this. So you can understand that why I'm cautioning you that as someone 19 years old to start pursuing this may not be very practical, but that's at least an explanation of the anatomy and how we help people in a situation similar to yours. So I think that maybe it would be a good idea for you to at least meet with your physician, your family physician, and just discuss this issue. There may be issues with hydration and skin care, or meeting with a dermatologist. Just think non-invasive and minimally involved at this time in your life, where you don't want to commit to doing things with that require maintenance. It's usually not practical for someone in your age range. So I hope that was helpful. I wish you the best of luck. Thank you for your question.